Okay, Leigh, do you think we should get started?
I think we can go ahead and get started with the intro.
Okay. On behalf of Access to Integrative Medicine Health Institute, also known as AIM, and the GW Office of Integrative Medicine and Health, welcome to a Mindfulness Experience, everyone. AIM is a nonprofit organization with a mission to provide vulnerable and low-income communities with access to whole person health and wellness. GW provides professional development, education, and community outreach to improve health and wellness through the Office of Integrative Medicine and Health. Today, our facilitators are Leigh, who is the Executive Director of the office, as well as the Director of the Integrative Medicine Programs at the GW School of Medicine and Health Sciences, and the fabulous Judi Eskovitz, who is a yoga therapist and Pilates instructor who can teach both adults and children.
Great, and I'm enjoying being paired up with Judi again, so fellow yogini. I am going to go ahead and share my screen because I do have a short little presentation that will be sent out to you, so don't worry about taking notes or anything like that. All right. So we're going to talk today about how do you prioritize your health and nutrition during a pandemic. We all know that it's really important to take care of ourselves, our health, and our nutrition, but how do you do that now in the time of COVID? So the first thing we want to do is make sure you're getting healthy food, but you're doing it with a minimal risk. So how do you do that? Well, you can plan what you want for the week, right? So plan out what you're going to have for the whole week and also backups. So have your list and some backups in case when you get to the store, they're out of whatever you want. That way you're getting in and you're getting out. You're really limiting your exposure time, and hopefully you'll be a very efficient shopper. The alternative, and particularly if you're high risk, is to consider online shopping and delivery. It's actually gotten to be a little more affordable, and if it's something that you're really concerned about going out because you are high risk, it may be worth the investment of having the delivery. Also allows the shopping to be really easy because you can look at what you have in the refrigerator and then walk over and shop and get all your recipes. And I personally really enjoy that aspect of it. So it's kind of a luxury as well. Another thing that really helps with this whole process is meal prep. So if you prep maybe your lunches or a couple of dinners each week, this helps you plan your shopping because you know you're going to be doing these recipes. But it can also reduce your stress during the week. Just eliminate having to cook 1 or 2 days a week sometimes can take the pressure off and allow you time to do other things, which we will talk about after this, what you can do with that extra time. It's also a great way if you have children to get them involved or anyone in your family involved. And set healthy habits early for the children, but anytime we can set healthy habits for everyone else. Okay, so what are we going to eat? We want variety. The quote that we always hear is, "Variety is the spice of life." There's actually more to it than that. It says, "which gives it all its flavor." So basically, life is bland and boring without variety. And that's true of absolutely every aspect of life, including what we eat. And part of this is because it keeps it interesting, right? So we want to enjoy our food, but it also helps you make sure you're getting different nutrients. So if you're always eating the same thing, you're only getting the same nutrients and maybe you're missing one. And we know that's not good. The other great thing is this allows you to be creative, and it's really important for our whole health actually to be creative. It increases your happiness, it reduces anxiety, depression, and stress. That's super important right now during COVID, right? We want to be happy and we want to reduce our anxiety, depression, and stress. So maybe try a new recipe. There are all sorts of online resources for being a little more creative. And the nice thing about cooking a new recipe is it's often less expensive than the alternative, eating out, buying prepared foods. So you're also hopefully saving yourself some money in the process. What else to eat? You should all know by now that we need you to eat the rainbow. Lots of different colors signals different properties. This little graph here is talking about the different aspects of food that are protective from cancer. Very important to have color, but I think sometimes people forget that that includes white. So I want to zoom in on the white aspects over here, which includes things like onions and garlics and leeks, or the allium family, as we would call them. Cauliflower, potatoes, turnips, mushrooms, celery, radishes, cabbage, fennel, anything that is either white or light green would fall into this group. And we don't want to leave them out. White is actually not a color, it is all colors. So in that sense, it's really important to get as well. But why actually is it really important? So it's got fiber, which we all know I love. So you get some fiber, you're getting potassium, magnesium, which are really important minerals that are actually not prevalent in many foods because they're not prevalent in the soil anymore. So you make sure you get a lot of those. And then when we're talking about things like health, such as cancer or heart disease, it contains a phytonutrient called quercetin. It actually contain lots of different phytonutrients, but the one that's most commonly researched is quercetin. It's actually also found in apples, by the way, which the white part of the apple. And it's shown to be beneficial for prevention of cancer and reduction of heart disease. So having the whole plant, be that an onion, an apple, a radish, fennel, is bringing these different properties. You're getting the nutrition, you're getting the fiber, you're getting the phytoprotective, anti-cancer properties. So that's why we need to get whole plants, and we need to get a whole variety of them in many different colors, which does include white. So we talk about what we eat, maybe we should talk about what we don't want to eat. It's so easy right now to whip out your favorite snack and eat a whole bag of it because we're feeling a little down, and that's probably not going to help the feeling down, and we know it's not healthy for us in the long run. So my advice is, when you go out and go grocery shopping, is just to skip the snack foods. If you don't buy them, you won't eat them. That's what I do. It's the easiest way to have willpower, is to not bring them in your house, because when they're there, you will eat them. The alternative is, if you do buy them, like say you have children, so they need to have a snack every once in a while. Keep it out of sight. If it's out of sight, it's out of mind. Keep it in a cabinet where you can't see it, not one that you're going to be going in very often, maybe a cabinet like above the microwave or something that you'd have to actually think about going to get it to see it. And then alternatively, you want to put your healthy snacks right at eye level. So anytime you open the fridge, right at eye level. Anytime you open a cabinet, right at eye level. So that's the first thing you see when you're hungry, and you pick that, right? You will just reach out and grab that because, oh, that looks good. That apple looks good. Same thing with leaving things out on the counter. I always have a fruit bowl, because when I walk by and I want a snack, I can just grab an apple instead of going into the pantry and getting, I don't know, pretzels or popcorn or something like that. Real quick, just want to refer back to the 2 previous handouts that I talked about before, and we will include them here because it still applies. So when you're doing your shopping, you might want to prioritize things that stay fresh for a week or more. That way you have some supplies. And what might that be? So fresh things like apples and citrus actually they're pretty sturdy, and they last for more than a week. And especially if you put them in the fridge, they will last for several weeks. Some apples actually can even last months in the refrigerator. Dairy, eggs, and then greens and herbs. And the greens and herbs, it's really important to treat them like a florist would flowers. So you want to put them in the refrigerator, but you want to make sure they have moisture. They're essentially cut flowers. So give them some moisture at their where they're cut. And you may even want to cut them again to make sure that they're getting that moisture, and then put them in the refrigerator, and then they can actually last a week. Frozen food lasts way more than a week, and it's actually often more nutritious and less expensive than fresh. So if you get frozen kale, rather than it lasting a week in the fridge when you treat it like flowers, it could be 3 to 6 months in the freezer. So it's a great way to stock up on things in case maybe you can't get out. Canned foods similarly last for a long time. We are worried a little bit about sodium with them, but you can reduce the sodium content by rinsing them. And I would also suggest buying a low sodium version. And then when you rinse it, you really do have a very low sodium product. Dry goods, so we keep our pantry stocked. Things like nuts, beans, fruit, pasta, rice, those all will last for many, many weeks, and they're good to have on hand. And then my favorite part of cooking is what I'm calling the flavor boosters. So this is how you really bring out your creativity and really get excited about the food, and it's not bland and boring, right? You bring your herbs, your spices, maybe some vinegar to give it a little bit of tartness, or some citrus to give it some freshness. You can also use condiments in your cooking. But one thing to watch out for that is a lot of them have added sugar. So try to find the ones that don't have added sugar. You also have to be mindful that a lot of condiments do contain salt. So if you're watching your sodium intake, that can be a concern. The one nice thing about condiments is they do tend to be very flavorful, so you don't need a lot of them. So say if you're using some mustard, the amount of salt and mustard that you're using to dip, I don't know, let's say you're having a little bit of cheese and you're dipping it in the mustard, the amount of salt in there is going to be very minimal. So if you're not using a lot of these condiments, the salt really isn't an issue. Okay, we're doing this today. We're staying positive. We are prioritizing stress management, and I'm going to recommend that you attend our weekly mindfulness experience, which you're already doing. But the really nice thing, and I don't know that everyone's aware of this, is you actually don't have to attend in person, though we love for you to, because it's kind of a community. But you can watch the recording of the one from this week or from any week previous. So if you can't make it, or if it's a Wednesday and you really need to have some mindfulness time, just go on our I got the link here, and I'll go out in the email. Just go on our YouTube list and you can watch any of the previous ones. So Judi has done one previously. If you really enjoyed that one, you can go back and watch that. And then, of course, social engagement, which again is part of the reason we would like you to attend in person if you can, because we want to engage with you. But you can also reach out to others. Sometimes we feel like we have to wait for others to reach out to us, and taking that initiative not only helps us with the social engagement, but it makes us feel a sense of purpose, right? We are actually doing something, and that can be in any form. Reaching out them, writing a letter, sending a card, just a quick text sometimes can be really meaningful. And also in terms of having a purpose, and it's something that is probably really needed now, is to give back when you can. So for those of us who are lucky and fortunate and have not lost our jobs, we can help support those who are in the other position. The local food pantry might be one way that you'd like to give. It gives you a sense of purpose. You are definitely going to feel good about giving. So I would highly recommend that if you have the ability. And if you don't, that's okay too, right? There's not a lot you can do right now to help in terms of volunteering your time. And that's what I would usually say if you don't have the financial means. But maybe there is. Maybe the food pantry does have a way of doing it safely and you can reach out. But if you can't, just don't feel bad about that. So many people are in that situation, and you are not alone. Routine. So routine is typically something that's important. We need to get in and have some good habits, but I feel like now it's almost more important to give us some semblance of normalcy. And what I would point out as the key elements of that are to get up and go to bed at the same time each day, even on weekends. If you stay up 2 hours later on the weekends, you are giving yourself what we call social jet lag, basically jet lag by choice. So it is your choice, and I would suggest that you choose not to do that because it's really tough on your body. You know how jet lag feels when you travel. You don't want to be doing that to yourself every week. Similarly, try and eat at a regular time. Maybe you can schedule time to eat dinner together, be that in person or virtually. Zoom dinner parties are a thing, and actually are pretty fun. Also, schedule your physical activity. And I say schedule it, like put it on your calendar. And that way it will happen, right? You're making it a priority and it will happen. If you just say, oh, I'm going to do all the things I need to do today, and then if I have time, I'll go for a walk or I'll go for a run, it's probably not going to happen. So you actually need to make time for it. Similarly, walking outside is really important. Just getting outside is really important. We have talked about this before. Every morning, get out before 11 a.m. and get some sunshine in your eyes. That resets your circadian clock. And then I would recommend you get another walk between 11 a.m. and 3 p.m. for about 15 minutes to get your vitamin D. Now, how do you do that? You need to have skin exposed with no sunscreen, and you will need a longer exposure time if you have darker skin. And that's actually kind of complicated, but luckily there's an app for that. which I've already told you about, but here it is again, the D-Minder app, which helps you track your vitamin D production, and it also times your exposure and warns you if you get towards the time that you might have a burn, which I personally think is very important, because while sun exposure and vitamin D production is fantastic for you, any sort of pinkness or any sort of burn is extremely detrimental and actually destroys some of the vitamin D that you made, so you undo some of your good progress. So we don't want to get to that point. Got some additional resources for you here to read at your leisure. The American Society of Nutrition did a whole piece on what I talked about today, but with way more details and lots more tips. So I would suggest going there. And then we've talked a little bit at Harvard Chan before. They have a great resource called the Nutrition Source. And they have an article about what you should eat, which gives you more details about some of the things I touched on. And also an article about adding color to your diet, and talks about some of the other colors in deeper detail. I went into detail on white, but it talks about the blues and the purples and the oranges, all the other ones, which usually get all the attention. And last but certainly not least, I want to make sure you all know about our podcast. We try to do fun and interesting topics, and it might be something to listen to when you go on your walks. That is the end of my presentation, so I'll go ahead and stop sharing. And we will take questions.
So I already answered the vaccine question. There was a follow-up vaccine question that I also answered, so for Cecile specifically. So then there's a question, could you add some info on the AIM page of recording of past programs, such as dates or topics, or am I supposed to go to the YouTube? I think everything's on AIM listed by the sequential, so you can scroll down. That just starts on top from the most recent, go back in time. I'm not sure how it's set up on the YouTube. Leigh, Janet, do you guys want to add to this?
So it's sequentially, and it lists the facilitator's name. So if you know you're looking for something that I did, or something that Dr. Kogan did, or something that Judi did, our names will be listed on there. But it also has the sequential date. So hopefully you remember about when it happened.
Okay, so the next question about flu shot is a very good one. So high dose versus regular dose, it's not about the strength. It's not a regular strength with a full strength. That's not how it's explained. It's a high dose versus regular dose. So anybody over 65 should be getting a high dose, and everybody else should be getting a regular dose. It appears that both vaccines are this year available in no preservatives, so without thimerosal. So those of you who are specifically concerned about mercury, you don't need to be worried. And those are multi-use vials. So they have multi-use vials that do contain mercury and some that do not. So you have to request specifically the one that does not. I actually, if you guys give me a couple of minutes, what I can do, I can share the screen soon to, actually I can probably copy paste it as to what MFA GW medical faculty associates will have. But I'm not sure if those exactly, there's actually a number of different vaccines. So I don't know which ones will be available in pharmacies, but I would assume that they will have similar options. And I'll bring that table in a minute.
Yes. Someone asked where to find the flu vaccine that's preservative free.
Yeah, they're going to be everywhere. You know, to the point, even in supermarkets. So any place that has a pharmacy, including places like Walmarts and Wegmans and whatnot, they're all going to have flu shots. There's no question about it. So, and insurance will cover, all insurances will cover them. So it may be easier for you to just go to any of those places without going through the doctor first and say, this is what I want. Over 65, you want high potency or high dose. Everybody else regular. It's actually not that simple. I'm giving simpler version. If you're less than 65 but have some comorbidities, you may also need high dose. In that case, you should probably talk to your doctor to get clarity on which one you should be getting. But if otherwise you don't have any problems or any medical concerns, chronic illnesses, then regular dose is fine. All right. The next question I think was about meeting with others outside for extended period of time. How far do you have to be safe without mask? I think we talked about this, at least 10 feet out, outdoors. Indoors, that doesn't really apply because the air is circulating unless you have a very specialized purification system of some sort, which most houses don't. Your HVAC at home, no matter how new your HEPA filter is not going to do anything for the virus. This is not going to work. So that's not going to be sufficient. And, you know, so if you're outside, that's okay, but I'm not sure what extended time means. Also, you have to make some decisions. So for example, I went kayaking for 5 days with a group of 20 people. We basically all decided we're going to be together. You know, we're all young and healthy, and everybody felt that we're going to be for such a prolonged period of time. And by the way, there was no soul around for like 100 miles away from us. So we had a decision that we're not going to use masks or any specific attempts to isolate, because it was just not possible. I mean, when you're camping out like this, it's just not really practical to try to do this because, you know, food is rationed and all that. So you could make certain exceptions like this but you know, you have to make a very concrete decision. So in this case, nobody did testing before, but everybody sort of said that they were completely symptom-free for X amount of time. They didn't have any new contacts in the prior 14 days. But again, I mean, we all drove through the you know, gas stations filled up with masks. Is that a contact? You make a decision. So, all right. I think I answered that. I hope I did. Where are we? Leigh, there's a question for you. Red foods, is watermelon the only red food good for?
I did actually answer that one. We decided berries was a good red food, raspberries, strawberries.
Okay, so flu shot in March, no, there's no such thing. First of all, next time, never get it in March. It's completely useless. Its efficacy in March is less than 1%. Because the flu mutates dramatically by that point. Even if they try to give it to you, there's somebody who's trying to give it to you is just trying to give it because there's a protocol, not because there's a head on the shoulders of that person. But you should, yes, absolutely, you should get one in October, simply because the fact is the virus is completely different this year. So whatever you got in March is not going to protect you. And I don't think there's any concern having several shots sequentially from any allergy or toxin exposure perspective. It's just an efficacy issue. So, yeah, again, all facilities should have preservative flu shots. So ask for them specifically. In fact, what I would recommend, you even have them show you the vial, because they can tell you one thing and do something else. We had that with one of our kids. One of our kids was vaccinated with something, and we only learned a year later when we got their records. We said one thing, they did something else. So we decided not to complain, but you know, you have a right to demand to have actual preparation be shown to you. So don't be afraid of that. They have to draw it anyway. So whether they draw it in the back room or in front of you, it doesn't make any difference whatsoever. Should senior, yeah, so I already answered that. Wait till first to second week of October to get the flu shot. And the reason for that is, as it's in the text, because the flu shot this year will last for 6 months or less. So if you get it right now, it will basically end sometime in early spring, and you will left unprotected in April, May. That's actually potentially quite concerning. And getting shot at that point, second shot, would not work either, because by that time virus is mutated. What you need is the antibodies to the current strain, not to the future strain. And
yeah, the thing you just said about the not having protection by the spring if you get the shot too early. Correct. I don't know about anybody else, but that's the first time I have ever heard that. And I've been getting a flu shot for it's more than 10 years.
Correct. So, Jeanette, the reason for that is that it's been kind of gradually growing of a concern. And the reason for that has been basically in the last 3 to 5 years, flu shot efficacy never was more than 50%. It was hovering between 30 to 50, but by the time of the season, it was at best at 10%. And so this decision to start making such recommendations, which are still not official, but they are made by MFA. So all the MFA doctors will be vaccinated starting on October 1st, not now, even though vaccine is already available for that exact reason.
I would also add that I feel like a lot of people push the vaccines as soon as they're available. I know I've already had my pharmacist try to give them to me, and that's very similar to what Dr. Kogan said earlier. That's about a protocol, not about them thinking. So just because someone offers you the vaccine doesn't mean that's the perfect time for you to be getting it.
Salome, if you already got a dose in August, there is no point getting another one in October. It's not, the problem is it's going to be exactly the same vaccine. If you get another booster, I don't think it's going to last any longer for you. So we're just going to have to cross fingers that your specific protection is going to last enough through the spring.
Well, I hope so.
Yep.
I should have waited. I thought early was good.
Okay. Well, that's okay. I mean, it is what it is. But you did get it. I'll tell you what, it's better than not get it at all. How about that? Okay. All right. Getting MMR, I don't think I can answer that question because I need all kinds of specifics. And if you have not been, you need to talk to a doctor, Rini. This requires, MMR vaccination requires specific discussion since there's an assumption you've had one as a child. So you need to know what the re-vaccination protocols are, and thus it's a discussion. If my roommate is waiting on COVID-19 test results, should I get tested or wait until after she knows the results? Not sure how to answer that. It depends on what's going on with your roommate. If your roommate is asymptomatic, just decide to test it just because, then I don't understand the reason why to get tested. Benita, this sounds like a very specific question. How about you and I address it in private? Because we need to wrap up and have Judi take over and start practicing, okay? So I'm gonna stop here.
Okay. Good afternoon, everyone. It's a pleasure to be with you again on this side of the Zoom. Today, our practice is going to focus on releasing tension and stress from the body and relaxation. We're going to start with centering and some breath work, and then we're going to practice a technique called PMR, which is progressive muscle relaxation. During this practice, I'm going to ask you to inhale as you tense and contract different muscles in your body. Hold the contraction and then slowly release the muscle tension as you exhale. So this is a great way for you to understand how your body feels while you're holding tension, and then how your body feels when it's relaxed. Studies show that this is a great way to manage stress and anxiety. It helps build the awareness between your mind and body and how your mind and body feel. And it can help you relax if you're having difficulty getting to bed, or if you wake up in the middle of the night and have difficulty getting back to sleep, because you can relax your body and then relax your mind. After we finish with the progressive muscle relaxation, we'll end our practice with a very calming and soothing light meditation. So to prepare for this practice, we're going to need 3 very simple things because the practice is very simple. First of all, make sure that you're seated on a chair. For those of you who are short like me, make sure that your feet can touch the ground. Then we're going to be extending our arms and legs Make sure that you have enough room in front of you to extend your arms and legs. And then I'm going to ask you also to remove your shoes, or if you're wearing sandals, remove the sandals so your feet are free to move easily and they're not constrained. If you're wearing socks, socks are fine. So let's begin with centering. Placing your feet on the ground and just feeling the stableness of the earth beneath you. Slowly close your eyes, pressing your buttocks into the chair and expanding your vertebrae, your back lifting upwards, opening up your chest and allowing your chin to be parallel to the floor. Take a moment now to just pause. And you may want to reflect on this centering thought, which is titled peace. It does not mean to be in a place that there is no noise, trouble, or hard work. It means to be in the midst of those things and still be calm in your heart. Now I invite you to place your right hand over your heart and your left hand on your belly. Feel the warmth of your hands on your body, helping to calm and soothe the body. Finding that place of peace inside. Take a slow, deep inhale through your nose, breathing from the belly up towards the chest, and then slowly exhale, releasing all the air from your lungs. Take another slow, deep breath in, belly to chest, and then slowly release from the chest to the belly. You can drop your hands if you like, but continue breathing for another 3 breaths. Slow, deep inhalation, slow, deep exhalation. And then slowly and quietly open up your eyes. Now, as far as the sequence goes, I'm going to just explain to you a couple of steps to break it down for you for this progressive muscle relaxation. I'm going to first give you some instructions about how you should be positioning your body. Then we'll inhale and we'll squeeze the muscles and hold for about 3 seconds. And then I'm going to ask you to slowly exhale, releasing the muscles and relaxing. The reason why I tell you to exhale from the mouth is that it really aids in relaxation. Okay, so we'll go very slowly throughout the body, point by point. Begin to bring your focus to your hands. And just place your hands in front of you. Your palms can be up, your palms can be down, whichever is comfortable. Make a fist with your hands. Then inhale as you squeeze your fists together, feeling the tension and holding for 1, 2, 3. And then slowly release your fingertips down, resting your hands on your lap. And just notice the feeling that are in your hands right now. Your hands might feel prickly, they might feel heavy, they may feel warm. Now bring your attention to your hands and forearms. Extend your arms out in front of you, hands parallel facing one another. This time, make a fist and move your fist inwards. As you do that, you're going to feel some contraction in your wrist. And when we start squeezing, we're going to squeeze the hands and the wrist and the forearms. So inhale, squeeze, 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 squeezing the forearms, feeling the tension, and then slowly and gently letting your forearms and hands relax. Noticing the muscles letting go. Now bring your attention to your biceps on your upper arms. Stretch your arms out in front of you, making a gentle fist, and then folding your elbows and having your knuckles facing your shoulders. Inhale, squeezing hard the biceps and holding for a count of 1, 2, 3. And then slowly relaxing and releasing your hands down to your lap. Close your eyes for a moment and just notice the tension in your arms just washing away. Now I'm going to ask you to bring your attention to your feet, your shins, and your calves, so the lower part of your legs. I'm not going to show you with my feet because with Zoom it becomes a little bit weird. So I'm going to use my hands to demonstrate instead of your feet. Begin by just lifting your feet up off the ground. And you notice that you can point your toes downwards, or you can point your toes upwards. When you point your toes downwards, it starts to contract your shins. So we're first going to focus on the shins and the toes and feet. Curl your toes under, point your toes downward, and as you inhale, squeeze the toes and squeeze the shins, holding 1, 2, 3. And then lower your legs down, noticing those areas becoming more and more relaxed. Lift your feet up again. This time you're going to flex your feet so the toes are pointed towards your chest. Inhale, flexing your feet even more, contracting the calves, holding for a count of 1, 2, 3, and then slowly, slowly, slowly releasing. Just taking time to enjoy that feeling of relaxation. Now bring your focus to your thighs and your buttocks. So those are two really, really big muscles. Place your feet together, ankles together, and knees together. Now I'm going to ask you to inhale, squeeze the thighs together and squeeze the buttocks, holding and squeezing for 1, 2, 3, and then slowly, slowly, slowly letting go. And just notice how it feels as you soften and let go of those muscles. From here, we're going to move to the upper body, starting with the abdominal area. So between the abdomen and back and neck and face, we typically hold tension in those areas. So if you like to, during your day, you can always just take one section of your body and squeeze and get the tension out and release. So you don't necessarily need to do the entire body. Bring your focus to the abdomen area. And this is where many people tend to hold stress and anxiety. So you might feel sometimes butterflies in your stomach, or you might feel that you have knots in your stomach. So this is something to help you relax. Take your navel, pressing it towards the spine. So you'll feel just a little bit of contraction in the abdominal area. Inhale, keeping the belly towards the spine. And now squeeze the entire abdominal area, the front and the sides, and squeeze, squeeze, squeeze. And then slowly relax through the mouth and let that go. Just noticing how it feels to relax those muscles. Now bring your attention to your upper back. Here I'm going to ask you to move closer to the edge of your chair. This is going to be a seated cat and cow. If you're into yoga, you're familiar with this. This can be done seated as well as standing up. So there's several steps here to prepare you. So we're just going to go through it one by one. First, take your hands and place them in the back part of your hips, almost as far back as your buttocks. As you do that, you're going to feel several things. The first thing that you're going to feel is that your chest is going to open. You might also feel that your shoulder blades move a little bit closer together. Lift your chin up to the sky so that you're opening up your neck. As inhale, think of squeezing the shoulder blades together, squeezing, squeezing, squeezing. And then slowly relax and let go. And just notice how good it feels to relax that upper back area. The second part is to take your abdomen or your belly button towards your spine, and you'll feel the lower back curling. Take your hands, placing them in front of you and clasping them. Flipping your hands over that the palms are facing you. Think of, as we're going to be doing this, think of bringing the heads of your shoulders inward, and now the shoulder blades will be moving outwards apart from one another. Rest your chin on your chest. Inhale, and as you exhale, think of separating those shoulder blades outwards, holding for 1, 2, 3, and then slowly, slowly exhaling down, releasing all the muscles in that upper back area. Now bring your attention to your shoulders. Being that we're doing so much work on our computers and in Zoom, the shoulders start to round a lot. And also tension, when we are tense, the shoulders tend to creep up. So we're going to encourage pushing the shoulders downwards so all those neck and shoulder muscles can relax. Starting with an inhale, squeezing the shoulders all the way up to the ears. Inhale and hold. 1, 2, 3, and exhale. Just feel that nice release that's in your shoulders. We're going to repeat that again. So start with your shoulders up. This time you can add all your arms and squeeze your hands as well to release even more tension. Inhale, squeeze shoulders up, squeezing the hands and arms. Squeeze, squeeze, squeeze. And then slowly let your shoulders and arms relax, letting them all go limp and relaxed. I'm going to add a couple of stretches here for your neck. We've done a little bit lifting the neck up and down. Now we're going to go from side to side. When I tell you to turn your head to the left, yes, that is my right, but I'm going to mirror you because it's a lot easier to follow. So inhale, lifting up, and exhale, turn your head to the left and hold. And then exhale towards the center. Inhale, lifting up. Exhale now to the right. And then inhale back to center. Now take the left ear and drop it down towards the left shoulder. Inhale and hold. And then exhale, bringing back to center. Inhale and exhale and hold. Other side. And then inhale, bringing back to center. The last body part to experiment with is the face. And I find that I never realize how much tension I'm holding in my face until I do the squeeze and relax experience. So I'm going to ask you, when it's time, to scrunch up your forehead, your eyebrows, squeezing your eyes, your cheeks, and your lips. So if you can imagine biting into a lemon, this is probably what your face would do. So take a big, deep inhale and then squeeze the entire face like you're biting into a lemon, holding for a count of 1, 2, 3, and then exhale, slowly relaxing, letting your face relax, and just feeling that tension releasing. So lastly, we're going to contract or tense our entire body at once. Your feet can be pointed, they can be flexed, definitely flexing your hands into fists, whichever works best for you. And what I'd like you to do as you're doing this is notice how much tension you feel when you're holding this tension. Notice how that body feels holding it all. And then notice how you feel when you can relax it all. Okay. So take a nice deep inhale. Contract all the muscles, squeezing, squeezing, squeezing. And then exhale slowly, releasing all of the tension totally out of your body. Close your eyes and just notice how you feel now that the tension has been released. Then you can open your eyes and we're going to move on to further a relaxation with our meditation. Either you can find a comfortable seat on your chair, or if you like to, if you wanted to lay down on the ground, that totally works as well. So begin to close your eyes and just relax, letting go. Letting go of anything that you're holding in your body and letting go of any stressful thoughts. Think of breathing in peace and relaxation and breathing out tension and stress. Start with the top of your head and imagine a warm, luminous light entering through the crown of your head. Let this warm, relaxing light melt over your entire scalp, releasing it and softening it. Continue to focus on this warm light as it melts over your face, softening and removing tension from your face. Let the luminous light travel to your throat and hold it there. Let it become soft and quiet. Let the swirling light travel down the back of the head into the neck, gently releasing each vertebra of the neck. Running down the neck to the shoulders, releasing, softening, opening each shoulder. Let this warm, luminous light melt and swirl down both your arms to the elbows, to the wrists, to the fingers. Your hands are heavy, warm, and thick. Go back to the top of the spine and let the warm swirl travel, filling your shoulder blades and back with warmth and relaxation. Traveling down the entire spine, releasing each vertebrae, softening them one by one by one. Go back to the front of your body. Take a deep breath in, breathing the luminous light into your chest. Let its warm, healing light wrap around your heart and hold it there. Another deep breath and pull the light into your belly, softening and relaxing it. Let it flow down into each hip, opening the hip joint, softening. The entire upper half of your body is relaxed and comfortable. Allow the warm feeling to cover the entire pelvis and buttocks area, flowing down each leg, softening and releasing tension. Imagine the light blazing out of the soles of your feet. Then check to see if there's any leftover tension in your body. And if so, go back to it and breathe into that area, letting go of the tension, relaxing the area. Your body is light and edgeless, now filled with total relaxation. So just take a moment now to slowly breathe in and breathe out. You can slowly and gently begin to awaken your body. You can wiggle your fingers and wiggle your toes and beginning. And if you're in a lying down position, you can come up to seated. You can place the palms of your hands together, thumbs by your heart, closing your eyes. May you have thoughts that bring you peace. May you speak words that bring peace. And may our hearts be filled with peace. Namaste.
Thank you, Judi. That was lovely.
Thank you so much.
Namaste.
So, Misha, does anybody have any questions for Judi or for Misha?
I think everyone is so relaxed right now.
Exactly. It's a good one.
Mm-hmm. I have to bookmark this one so you can watch the recording over and over again.
Okay, well, if that is it, I am going to wrap things up. Thank you, everybody, for coming. Thank you, Leigh and Judi and Misha, for answering our questions, helping to give us balance, and just everyone have a lovely weekend.
Thank you.